iman wajib aman, wajib imun. Berolahraga, riang gembira, mencegah kita jatuh sakit.
Makan bergizi tiap hari, tidur cukup itu pasti.
Dan janganlah panik, berdoa tiada henti, wajib iman aman imun. Pakailah maskermu,
Jaga jarakmu,
cuci tanganmu selalu. Kita raih bahagia dengan iman aman imun, badan sehat bangsa kuat. Kita raih bahagia dengan iman aman imun, badan sehat bangsa kuat.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. First of all, I would like to thank international media colleagues for attending this press conference sessions today. And special thank to Ms. Ismi Damayanti from the Nikkei ASEAN Review for moderating today's sessions. Are you there already, Ms. Ismi?
Hello, Pak Wiku.
Hello.
How are you? Wish you all the blessing for the holy month of Ramadan today. A little bit of highlight. Indonesia is currently under very important time for the transmission control with the PPKM Mikro, the start of Ramadan season, as well as ongoing vaccination program. So let's hear more from you, Pak. So the time is yours.
Okay, thank you, Mbak Ismi Damayanti. So this afternoon, I will be delivering an update on the COVID-19 management in Indonesia, including relevant regulations that have recently been issued by the government of Indonesia. And today's press conference coincides with the first day of the fasting for Muslims. And this is also the second time Indonesians have had to fast during a pandemic. What makes it different this year is that the government of Indonesia is comparatively better prepared to face any challenges that might come up during the holy month of Ramadan and during the Idul Fitri 1442 Hijriah celebrations next month, based on some lessons learned. In general, COVID-19 management in Indonesia is steadily improving. Active cases have decreased, and daily confirmed cases and deaths are under control, and the recovery rate is steadily increasing each day. Needless to say that the government seeks to maintain this positive trend. In their effort to do so, the Ministry of Religious Affairs of the Republic of Indonesia has issued Circular Number 4 of 2021 as a guide in the implementations of the Ramadan worship and also the celebrations of the Idul Fitri. Another regulations pertaining to Idul Fitri is the circular of the head of the COVID-19 Handling Task Force, number 13 of 2021, regarding the prohibition of mudik during Ramadan and also the celebrations of the Idul Fitri in 2021. Unlike the previous year, this year the government has strictly limited mobility from 6th to 17th of May 2021, given that positive cases are more than likely to increase following extended holidays based on the previous lessons learned. And the daily updates of the cases in Indonesia on the 12th of April 2021, the additional positive cases was 4,829, and the total active cases was 109,372, which is 6.9%. So this is below 10%. And then the total recovery case up to now is 1,419 and 796, which is 90.3%, which is above 90%. And then the total death case up to now is 42,656 or 2.7%. So if we look at the weekly development of the COVID-19 positive recovery and death cases, kindly pay attention to this development as we have witnessed an unfavorable trend this week. The task force is disappointed by the increase in positive and death cases, as well as the decrease in recovery. New cases this week increased by 6.3% and was contributed by Banten with over 6,000 cases in 1 week, followed by South Kalimantan with 249 cases and Riau with 204 cases, and South Sulawesi with 94 cases and Bengkulu with 62 cases. The number of deaths have also increased by 0.9% this week, which is once again contributed by Banten with 149 deaths, followed by the Central Java by 31 deaths, and East Java by 13 deaths, Riau by 9 deaths, and West Nusa Tenggara by 5 deaths. So although Banten recorded the highest increase in positive cases and deaths this week, their number of recoveries have also comparatively risen. Despite the 7.8% overall decrease this week, Banten witnessed a high recovery rate with 379 recoveries. I'm appreciative of the effort made by the other provinces that have also recorded an increase in recoveries. NTT with 268 recoveries, Yogyakarta with 254 recoveries, Riau with 230 recoveries, and Papua with 127 recoveries. So Banten's above contributions are behind the increase in positive cases and death nationally due to the process of recording and reporting data that is still synchronized between the center and the regions. We hope that the synchronizations of recording and reporting can run well so that existing data can be accurately used as a consideration for effective and targeted decision making. Here we have the weekly risk zonation map as of April 11, 2021. And we can see here in the figure that there is a slight increase in the number of districts or cities in the red zone of high risk by one region from 10 to 11 districts and cities, and an increase in the number of areas in the orange or moderate risk zone by 27 regions from 289 to 316 districts and cities. The increase in the number of the red zones area has occurred in the last 2 weeks and is different from the increase in the orange zones area that occurred recently this week. Meanwhile, the number of districts and cities in the yellow zones has decreased. As many as 6 districts and cities moved from the orange zones to the red zones and 55 districts and cities from the yellow zones to the orange zones. This development is unfavorable and also alarming. Although the majority of the districts and cities are in the orange and yellow risk zones, it should be emphasized that this condition is dynamic and any developments, whether positive or negative, depends on how we, both as a society and the government, behave. In principle, positive development should be followed up with consistency in controlling COVID-19, both through the tightened disciplines in implementing health protocols and formulating policies that are anticipatory and facing negative changes by evaluating their control through both behavior change programs and also policies. Next, I will provide an update on the formation of regional posts, which is an element of the micro PPKM implementations. As of April 11, 2021, as many as 14,093 posts have been formed across 323 districts and cities in 31 provinces in Indonesia. This is a significant achievement as these posts have positively impacted health protocol disciplines and the development of the positive cases. We also highly appreciate regional initiatives by non-priority areas in creating several posts, as many as 426 posts spread across 12 provinces, namely West Sulawesi, Lampung, Riau Island, West Sumatra, Jambi, Bengkulu, West Kalimantan, Southeast Sulawesi, and Gorontalo province. The existence of these posts or postcodes at the bottommost level, that is the community, is part of our COVID-19 policy and reflects national independence. Therefore, in the future, I hope that the new posts are created, which are also accompanied by performance monitoring, so that the impact of this post of COVID-19 control at the community level can be more effective. Now I will announce the latest circular from the head of the task force, which act as the basis for our Ramadan and Idul Fitri policies, namely the prohibition of mudik in order to control COVID-19 transmission. The implementation of the policy is more detailed and is technically regulated by each sector, such as the Ministry of Transportation, the Police, and the Ministry of Religious Affairs. And based on the existing facts and past experience, the government is trying to design policies that uphold the main principles of public health, public safety and health. Therefore, it stipulates the temporary prohibition of mudik, which take effect from the 6th to the 17th May 2021, with the exceptions of logistics or distribution services, as well as urgent needs such as for work or official travel, visiting the sick or deceased, and services for pregnant women with a maximum of one companion, and other maternity services with maximum of 2 people. However, it should be noted before traveling for exempted parties, there are travel prerequisites that must be met, namely a permit from the head of the work agency, specifically for civil servants, SOE employees, and armed forces and also police. Permits will be given by the Echelon 2 level officials with wet or electronic signs affixed. Informal sector workers and communities with urgent needs must ask for a travel permit from the village or sub-district according to their respective domiciles. I need to emphasize that this letter is valid for individuals only, for round trips, and is mandatory for those aged 17 years and older. Apart from the aforementioned requirements, mudik is not permitted. If it does not meet the above requirements, a travel permit will not be issued. And also, it should be noted, during the mudik period between 6 to 17 May, there will be a screening for travel permits and COVID-19 negative certificates by armed forces and also by police and local government officials, referring to Task Force Circular number 12 of 2021 for domestic travel and Task Force Circular number 8 of 2021 for international travel. And this operation will be carried out in strategic areas such as arrival gates or control posts in rest areas, large city borders, checkpoints, and agglomeration area isolation points. which is a single area consisting of several city or regency centers connected to each other, especially for Indonesian citizens who want to return to Indonesia or repatriation. If there is no urgent need, they are urged to temporarily postpone their return home in this period in the hope that it can prevent imported case with mutated variants. If a traveler is found who does not meet the travel requirements, including for mudik or inter-regional tourism, officers have the right to halt the trip, and the person concerned must return to the place of the origin of the trip. Please also note that people who are permitted to travel during this period are required to self-quarantine for 5 times 24 hours upon arrival at their destination prior to the carrying out activities. Quarantine is carried out at the facilities provided in the form of local government facilities and hotels that can strictly implement health protocol using independent fees. Meanwhile, regional task force as these destinations are required to optimize their performance, particularly for village post function, as well as those related to the worship and traditions during the month of Ramadan and Eid that are more likely to violate health protocols, for example, by identifying the crowd points in the local areas, socializing of the appeal to not go home or mudik, restricting activities at the household level, restricting new entrants, and also screening travel prerequisites documents belonging to migrants, and also monitoring the implementation of self-quarantine by travelers, and dispersing crowds directly on the spot. Once again, I must emphasize that previous experience of extended holidays must be used as a basis for the consideration in policy planning. When such a momentum occurs, a crown will inevitably from when traveling or at the destination. In principle, prohibiting mudik is an effort to prevent a spike in cases, but it is not the only policy we are relying. To be able to ensure anticipatory efforts run well, community activities need to be controlled holistically through the community participation supported by their wisdom to control their mobility, through professional law enforcement officers in charge of enforcing rules in their field, and through administrators of the social and economic sectors who are obliged to carry out the health protocols with utmost disciplines. All level governments are united and mutually support the mudik policy this year, which has been regulated in the circular of the head of the COVID-19 Handling Task Force, number 13, year 2021. We are expecting the public to comply with this policy that has been issued by the government. Mudik prohibition also applies to civil servants in accordance with the circular letter, the Menpan RB number 8 of 2021. With that, we come to end of our briefing this afternoon, and we will continue with the media questions and answer sessions. Thank you.
Thank you, Professor. There are a few questions coming in already from the media. First one is from John Macbeth, Asia Times, Sintasirai, Jakarta Intercultural School. The head of the China Centers for Disease Control was quoted on the weekend as saying, Chinese vaccines don't have very high protection rates. Can you please explain what that means to you and how you plan to deal with the concern that is likely to be felt among Indonesians who have already been vaccinated with Sinovac and Sinopharm? Does it indicate they will have to be vaccinated again in, say, 6 months? Thank you.
Okay, thank you, Asia Times, and also Jakarta Intercultural School. In principle, the COVID-19 vaccines is a relatively new biological products in the world and produced in a very short time frame. Therefore, we cannot deny that there are maybe imperfections in it. That being said, that the drug regulatory authorities, including BPOM in Indonesia, have considered several aspects. The illness was identified as the cause of the public health emergency. And second, adequate scientific evidence pertaining to the drug security and efficacy exists. And the third is the quality that meets applicable standards and adequate drug manufacturing methods. And fourth, has more benefits than risks based on a risk-benefit analysis. And the fifth, there are no drugs or adequate management alternatives. So the Sinovac vaccine has already passed a series of the clinical trial domestically and also abroad, and has also obtained emergency use of authorizations from the National Food and Drug Agency, as it has proven to be safe and efficacious. Moreover, immunogenicity produced by the Sinovac vaccine based on the Indonesian clinical trial is quite acceptable at 65.3%. And it must be emphasized once again that the different efficacy rate of the Sinovac vaccines in the clinical trials, both in Turkey and Brazil, at 91.25% and also 78% respectively, is natural, considering the differences in the characteristics of the recipient populations. As for information from the Chinese Center for Disease Prevention and Control, the government is currently studying and waiting for recommendations and decisions from BPOM and also ITAGI as the authorized bodies to conduct a review of the vaccines used in COVID-19 vaccinations. And the medical world experiences frequent developments as research is ongoing. Currently, vaccination is still going according to plan using existing vaccines.
Thank you, Professor. The next question is still from Asia Times. As far as we know, China has not embarked on an extensive nationwide vaccination program of its own. Does that make Indonesia, as the world's fourth biggest country, Sinovac's largest client? How many doses of the vaccine have been administered so far, and how many more doses have been ordered so far? Thank you.
Okay, thank you. To date, approximately 13.9 million doses of vaccines, both the first and the second doses, that have been administered to the people of Indonesia. Moreover, Indonesia ranks 8th globally as the country with the fastest COVID-19 vaccinations. And the government, of course, continues to establish communication with other vaccine providers to meet domestic vaccination needs, as well as to anticipate the delay of imported vaccines. I'd like to emphasize that apart from the Sinovac vaccines, Indonesia has received 1.1 million doses of the AstraZeneca vaccine from the COVAX-Gavi Alliance. And the government of Indonesia is also in discussions with other providers such as Pfizer and also Novavax. Therefore, Indonesia doesn't solely rely on Sinovac in terms of the vaccine supply. And the government of Indonesia is doing its utmost effort to ensure that the vaccination program can be conducted sustainably. Therefore, many Indonesians can be protected from the virus. Thank you.
Thank you, Professor. Following up to that, still from Asian Times, what lessons is Indonesia drawing from Chile, which has relied heavily on Sinovac to roll out one of the world's fastest vaccination campaigns? Thank you.
In principle, the government of Indonesia continues to strive to provide vaccines for all Indonesian people. Thus far, a total, again, 13.9 million doses of vaccines have been administered to Indonesians. And nevertheless, the national vaccination program is still constrained by the limited availability of the vaccines and public perceptions in understanding the importance of the COVID-19 vaccines. Therefore, the government will continue to strive to meet the needs for vaccines by increasing production and also accelerating domestic vaccines development. At the same time, the government will also continue to disseminate information to the public on the importance of the vaccinations to protect themselves from COVID-19.
Okay, Professor, last one from Asia Times. I understand from a recent Philippine report that Sinovac cost US $17 a shot. Assuming it is the same price in Indonesia, how does that compare with what the government is paying for other vaccines like Pfizer, Moderna, and AstraZeneca? Thank you.
Okay, a large budget has certainly been allocated for vaccine procurement. As for prices, Sinovac cost $13.3 per dose, Novavax $7 per dose, and AstraZeneca is $5 per dose. However, what most important is that Indonesia can receive the COVID-19 vaccines so that it can run the national vaccination program to protect its people. Thank you.
Thank you. The next question is from Ismira Lutfia Tisnadibrata, freelancer from Arab News and Bangkok Post. She has two questions. The first question is, now that the registration for the Gotong Royong vaccine is closed, will there be another phase for registration open anytime soon?
Thank you to Arab News and Bangkok Post. Currently, registration for the second phase of the Gotong Royong vaccine is closed. The enthusiasm among participating companies in this program is very high, and Indonesia Chamber of Commerce, or Kadin, plans to open registration for the third phase.
Her second question, the current closing, is it mainly because of administration management for those that are already registered, or is it because of policy reversal, concluding the program?
Currently, Kadin, Bio Farma, and also the government of Indonesia are conducting technical discussions regarding the Gotong Royong vaccination program. In principle, the private sector is ready to carry it out, but currently it is still waiting for certainty on the availability of vaccines imported by Bio Farma. Thank you.
The next question is from Marcel Rumlaklak from Marriott International. When will free vaccination for Jakarta tourism workers be conducted? As of now, tourism worker vaccinations is mostly concentrated in Bali.
Thank you, Marriott International. The government of Jakarta has conducted free vaccinations for those in tourism sectors, such as restaurants, catering business, wedding and event organizers, hotels, and others on the 2nd to 6th April 2021 at Gelora Bung Karno. And also there are 1,342 people from this sector that have been vaccinated. However, vaccinations are still limited as the provincial government of Jakarta is currently prioritizing vaccinations for the elderly. Thank you.
The next question is from Mr. Edward Davies from Reuters. He is interested to know how negotiations are going to get additional shots for China after issues over AstraZeneca deliveries. Also, is there a possibility that Indonesia can secure additional AstraZeneca doses from countries that have decided not to use it for some categories or recipients?
Okay, thank you for Reuters. The Indonesian government continues to hold talks with vaccine providers to obtain the COVID-19 vaccines. In addition, the government also continues to accelerate domestic vaccines development to reduce dependence on imported vaccines. And to meet domestic vaccines needs due to the embargo imposed by India, Bio Farma will continue to increase its production capacity of the Sinovac vaccine by 25 million doses. It is hoped that through this increase in vaccine production, domestic vaccines needs can be met. Thank you.
Thank you. The last question is from Gita from Voice of America. She would like to ask about the idea of publishing COVID-19 vaccine passports as a requirement to travel. Some countries have indicated that such a passport will be created. However, WHO has not agreed on it. What does the task force think about it? Is it safe for vaccinated people holding such passports to travel to various countries? Does Indonesia plan on creating such passports?
Thank you, Voice of America. Currently, vaccine certificates cannot be used as health passports. It is important to know that the further studies need to be carried out on the effectiveness of the vaccines in creating individual immunity in those who have received the COVID-19 vaccines. If there is no valid study results, then there is no guarantee of individuals' immunity. Thank you. So with this, I would like to have a closing statement. Before we move on the live sessions, I'd like to emphasize that while global vaccines production is estimated to increase in the coming months, to date, nearly 130 countries, or equivalent to 2.5 billion people, have not been able to access these vaccines yet. We need to understand that effective protections means protecting the community as a whole and not just one particular region, because in principle, humans are mobile, and even though there have been strict screening process in place, chances of transmission still exist. Therefore, I reiterate that vaccines are not silver bullet, and there are still many other ways to control COVID-19 that can be re-optimized, and this requires the participations of the several elements, not only the government and also society. Thank you very much. So, Mbak Ismi, are we going to have several questions? Yes.
Can I have additional 4 questions submitted through chat?
Yes, please.
Okay. First, from our colleague in the Australian, from Chani, what are the vaccination policy for foreigners, as well as our friends in the foreign correspondent already asked? And there's also concern that there are international schools with foreign teachers. Would like to know as the rollout for new academic year in July will be open for the schools.
Okay, thank you. So as I mentioned earlier, that the supply of the vaccines globally still limited. And we have the policy in terms of the priority groups in Indonesia that will be vaccinated. And we are following that order. And then we hope that we can also protect the foreigners who are in Indonesia to be vaccinated later. Thank you.
Okay, thank you, Pak. The next one from AFP. Anya asked, I believe it was mentioned last week by Ibu Penny from BPOM about the Sputnik Sputnik vaccine observation, which is underway. How is the progress so far? Will we eventually use this Sputnik vaccine?
Yes, thank you. So for the Sputnik vaccines, I believe we are still in the process of negotiating. And we will provide the details once some agreements are met. Thank you.
Okay. Next one is related on the vaccination to elders, as I believe Health Minister Pak Budi already referred them as the priority, as the current priority for vaccination target. And so far, there's only been 8.2% of the target of elders has been vaccinated. What are the problems? What are the challenges? And how will the government and the task force address and mitigate such challenge?
Okay, thank you. As mentioned by Minister of Health, that the vaccines availability are still limited, and there are some problems in terms of getting the vaccines. In terms of the vaccination itself in Indonesia, we don't have any problems. So therefore, at this moment, the vaccinations to the elderly still not cover as what we are expecting. But with the availability of the vaccines in the future, we hope that we can catch up with what we are planning to do. Thank you.
Okay, thank you, Pak. The next one is about mudik. I believe it has also been discussed a lot in social media of why is mudik prohibited while the tourism places are still open. Aren't you afraid of the flood and the transmission rate to rise instead from the mudik destination? So it will be from the tourism places. How will you control that?
Yes, we learn from the past experiences that almost always after a long holidays or weekends, it's followed with the 2 weeks up to 3 weeks after that, followed by the increase of cases and death. And we don't want to have that to occur during or after the Ramadan, and therefore. And we know that mudik usually have high people mobility in Indonesia. Therefore, we prohibit the mudik to prevent the spike of the cases right after the event. So that's why we prohibit that, and we far in advance to make that policy and inform the public so that they should understand the situations, not only the mudik itself, but also during the salat and also the exercise during the month of Ramadan itself. So that's the comprehensive policy to make sure that we can control the cases during the Ramadan and also the Idul Fitri. Thank you.
Thank you, Pak. The last one, it's returned on the vaccination issue. As there are issue on the supply at the global level, will Indonesia adjust this one? Sorry, this one is from Christine from Kyodo News. Will there be adjustment to the vaccination target to be met by this year, or will there be adjustment to next year by the first quarter or even the first half to be done? Thank you.
Okay. We are always measuring the situation, and if something occur in terms of the availability of vaccines, of course, it will influence the planning, and of course, we will readjust when necessary. And in the same time, we want to make sure that the vaksin Merah Putih has to be in place soon. So that's why with the parallel approach, with what we have planning in terms of purchasing vaccines from overseas and also providing from internally in Indonesia with vaksin Merah Putih. Thank you.
Okay, thank you very much, Pak. I believe that wraps up the question from the chat of our session today. Again, thank you very much for your time.
Okay, thank you very much for all who are attending these sessions. Hopefully it's clear, and let's cooperate for the future sessions. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Jalani hari dengan 3 wajib iman, wajib